planned for Major General Hara. When we looked at COVID-19, we realized it was an invisible enemy that spreads rapidly throughout the community. We watched it start in Asia, move into Europe, and then now spread across the United States, moving westward. What we did was we created and defined what our end state would be for Hawaii. And that would be normal state operations, which we defined as a vibrant economy celebrating our aloha spirit throughout the state. We knew we needed to get the state back into that condition. When we looked at 3 weeks ago, the original current state, it was characterized by difficulty to accurately identify the virus, limited enforcement of social distancing, quarantine, and isolation orders, and a lack of a coordinated message of all operations in response to COVID-19. We also saw a lack of future plans that would create this late response in such areas as cyber threats and supply chain. We developed 4 lines of efforts and defined the objectives for each. So line of effort 1 was prevent and protect. We believe that by achieving the threat of COVID-19 no longer a threat of transmission and minimum risk to public health, if we can achieve that through protection and prevention, we would move closer to our end state. Line of effort number 2, we looked at the successful treatment of those infected with COVID-19. At the same time, protecting the health systems throughout the state, our capacity to treat all patients. Line of effort number 3, information and public outreach. We saw this as needing a unified message across all mediums that encourage the public to abide by policies of the state leadership. Number 4, supply chain management. If we can achieve uninterrupted supplies throughout the state that continue to meet the needs, then we would move that much closer to a normal state of operation. We developed one slide. I'll have Major Earl Suniyoshi brief this slide.
My name is Major Earl Suniyoshi, and I'll be briefing you on the COVID-19 state response condition alert level. What you have in front of you is a color-coded framework that will provide or will assist in the public messaging, as well as provide a common understanding of the state's threat level, along with the associated situation condition, the impacts to daily life, as well as the responses by both the public as well as the state. The levels that we've identified are level 1 from left to right. Level 1, no disruption in green. Level 2, minor disruption in yellow. Level 3, moderate disruption in orange. And level 4, major disruption in red. If you were to transpose this to the curve, it would begin with level 1 on the lower ends of the curve, followed by yellow, level 2, level 3 orange, and towards the top of the curve would be level 4 red. Ultimately, this tool would provide expectation management for the public, for the state's responses as well as the public's. I'll be followed by Major Tim.
Good afternoon, Senators and State Leaders. I'm Major Ruben Kim. In front of you, I'd like to quickly present a decision-making tool that we've adopted using the military decision-making process to provide General Hara with some predictability in making critical decisions in a timely manner in order to get ahead of the virus to mitigate impacts to our community. What you see before you are 16 questions, which we call reporting requirements, that provides us indicators, conditions, or criteria we anticipate to see in our environment. These reporting requirements, when observed, trigger a specific response based on our pre-made decision points. The premise of these tools are to equip the incident commander with decisive and responsive actions. For example, ICRR number 10, when triggered, the incident commander will be notified that the ICU capacity for the state has exceeded 60% and will in turn allow him to make a decision to start the process to decompress the hospitals. We've also created what we call a decision support matrix, and right in front of you on this slide we have our decision support template. This tool provides General Hara with a graphical representation of when we anticipate a decision is to be made relative to a projected curve. As dynamic as our current environment is, at a minimum, the template provides us with a window for decision making in an effort to respond appropriately in hopes of flattening the curve. To sum it up, the decisions matrix provides the incident commander with what critical decision to make, and the decision support template guides him when those decisions need to be made. This concludes my brief. I'll turn it back to General Hara and Colonel Barros for questions.
I just wanted to quickly share what the National Guard is doing currently. We have soldiers deployed on all islands supporting all counties. We're doing airport screening, roving security checkpoints, and static security checkpoints. We have soldiers at all airports on all islands. We are preparing our plans to support, assist with wraparound services. We have plans to assist with contact tracing and tracking and follow-up. As a last resort, we can augment ambulance services. We're looking at a plan for disinfectant support and also call centers. By the end of this week, the National Guard will have 1,300 soldiers and airmen in support of COVID-19 response. So,
Did you take any questions?
Okay, we have Senator Gabbard on the line. He had 3 questions. Senator Gabbard?
Hello?
Hi, you have 3 questions for the General?
Can you hear me okay?
Yes. You can ask your 3 questions.
Okay. Yeah, Senator Mike Gabbard, representing District 20 out in West Oahu. My first question is, given that Honolulu, Kauai, and Hawaii, the island mayors have announced the requirement that people wear non-surgical masks in public, it seems like there to be more education related to how non-surgical is defined. I mean, everyone knows that the cloth masks are non-surgical, but there are many types of masks out there that are being, at retail outlets. So could you work with the mayors in coming up with some guidance for the public on this?
Yes, sir. Yes.
That because we've had a couple of calls from my constituents, they understand about the N95, but they've got some of the duckbill masks and some of these other blue masks. Are those okay to wear? They just don't want to get busted, okay?
Okay.
Okay.
Yeah, so I think it's really any kind of mask, right, for
Do
outside.
you want to explain the chain of command for communication, that communication part of incident command?
Right?
So as you communicate things like this statewide, isn't that Cindy and some of
Yeah, so as part of the structure, right, the National Response Framework, for me as the incident commander, we created the Joint Information Center, which is Cindy McMillan and a bunch of the public affairs and public information officers. And that's one place to get information going back and forth. And then also if anyone has any great ideas, advice, or even resources that they may want to offer up, that the email of covid.kokua@hawaii.gov, and again, covid.kokua, one word, at hawaii.gov, and then that will get staffed, and then sent to the appropriate emergency support function.
Okay, and then you had a second question, Senator Gabbard? Okay, and then you had a second question,
Yeah, what is the current status of the federal stimulus monies for economic recovery? I'm hearing about the individual payments for residents, they're happening now, but how about the bigger lump sums that are supposed to be coming for our state?
I don't know the answer to that. I know it's supposed to be here shortly. They said the framework is set, but we're working with Rona Suzuki on the federal the 1 point, I think it was 1.25 billion CARES Act stimulus.
Okay, members, any other questions?
Okay, and then the last question I had was, I noticed that California, Oregon, and Washington, their governors are partnering on a shared approach for reopening their economies. Is our state considering joining those West Coast governors in this collaboration?
Yes, the answer is yes. So I just had a discussion today with Governor Ige. He agreed he's going to be calling those other governors. As an example, what I told him what could be beneficial. Let's say we want to open up flights again. And if there's some way that we can do COVID-19 testing at the departure airport, then let's say we know for sure like SeaTac Airport and LAX, if they can do this testing, then we can be more comfortable with allowing tourists to come in. And I think that could set the model, right? We start on the West Coast, build this partnership, and maybe some other states will say, hey, that's a great idea. That's a great model. Let's pile on. So yeah, just today I had a discussion with Governor Ige, and he supports it.
Okay, mahalo, General. Thank you for you and your staff for all you do. Aloha. Thank you.
Okay. Can you guys go back to the slide with the point three colors? Okay, so your communications team with Cindy and Kenneth, they're gonna come up with a strategy to communicate.
Yeah, and then we're going to put this out. We'll publish this. Correct.
Okay. Questions?
So I have one. You know, my district has a lot of condos, and the governor's proclamation says that the shelter in place is your condo unit, but they haven't had any instruction of what that means. You know, you can go outside in your condo or what. Is there going to be some instruction on these kinds of proclamations where you can give a little bit more instruction to people? Is that your job?
So the stay-at-home order is really you stay at home unless absolutely necessary, right? And then there's certain things that we said you can't go. You know, if you need to go shopping for food, pet food, medicine, go to work. And other than that, or exercise, right? We said exercise is okay, but you shouldn't be having parties or going to parties. Those things should not be occurring.
Even in the condo unit, they shouldn't really be socializing in that condo.
Yeah, absolutely,
it's just
right.
Their
Yes.
apartment.
Yeah, so Senator, you know, we keep saying, right, and the only reason why this thing is still continuing to spread is we're really not taking that social distancing. If everyone followed the social distancing, you know, like how you folks are spread out here, how we're leveraging technology so you don't want to have too many people in the room, we wouldn't have the spread. It would be even lower than what it is now. So that's why we're pleading with the public to please follow all of the procedures. Don't be throwing these parties. Don't go out to the sandbar to have your parties out there. We're just placing each other at risk. And if everyone follows the social distancing, we can even flatten the curve even more and put it in the right direction. And we can start releasing some of these things that, you know, other strict policy measures. That's really what's going to stop this. It's not all these other things and what I'm forcing you to do. It's each of us as individuals.
That's the mask that we wear.
Yeah.
Okay. Senator Keoho Kalole.
Thank you, General and Colonel, for your work. What conditions, two-part question, what conditions would necessitate the mobilization of National Guard to execute some of the functions in this framework? And would you consider mobilizing National Guard to address the staffing backlog in the unemployment insurance program given the fact that if people cannot eat because they have not received a paycheck in weeks, that we could potentially have disruptions to these social distancing policies at a minimum, given the nature of the problem.
Okay. So Senator, first off, I think you noticed, and Colonel Bars talked about this, is we are going to be activating about 1,100 guardsmen, right? Army Guard and Air Guard. And this is why we did it, is I keep telling you, our center of gravity for the entire state, anyone that is looking at providing support to the state, our center of gravity is responsiveness. To be able to be responsive, we cannot be late to need, right? If we need additional hospital capacity, when they need it, it needs to be there. But to build their responsiveness, we need to anticipate the needs. And then once we anticipate the needs, then we need to have the people, the equipment, the supplies, and the training in place. So then when they do ask for this, then we're ready to go the very next day, or maybe sometimes even the same day. And that's why we felt critical that although the requirement and the request for assistance is not there yet, that it was important that we have the guardsmen on status and ready to go. Now, to your second part about using guardsmen for the backlog at DLIR, I am against that, and let me explain why. Is there's a pool of state employees that were considered not non-essential workers, right? I mean, everyone's essential, but really non-emergency essential. And then they didn't have the job to where they can do their job from home, right? The telework capability. So there's this huge pool of talent and resources that need to be provided to DLR, need to be provided to the other departments, and then need to be provided to the Hawaii Tourism Authority, who's doing a tremendous job at supporting us with tracking these tourists and the returning residents to Hawaii, doing the calls and everything else, making sure we're enforcing the self-quarantine order as they come into the state. And the point is, I don't want to dwindle down and start doing every little small, I call it nitnoid, right? They do a nitnoid mission, and then next thing you know, and I need it, let's say there's an outbreak, and one of the projected missions is, hey, we need to go in there and do additional contact testing, right? I need to know how bad this is spreading. And by the way, that we also should go and help with sanitization and disinfecting a building, as an example. But if I got on doing call centers and all these other small things, I lose that capacity and capability.
Especially since you have
I understand that, General, and not to belabor the point, but that's why I asked what would necessitate the mobilization of National Guard. Because frankly, you got HTA voluntary participation 3 weeks ago in implementing the quarantine order, and it's been 3 weeks that the Department of Labor has been 58 men short. And so what crisis level do we need to reach on a particular program area for the National Guard to go, you know what, it's time for us to step in and get it done? Because we've had 3 weeks of people not getting paid, and we are going to reach a point, if this is not addressed by the administration, where there is a threat level that could potentially be reached.
Right.
When you have people who can't afford to feed their children. So I'm asking if there is some sort of threshold. It's your determination and the administration's to make. So I respect your decision if you make it. I just want to understand where we're at in other areas of state governance. What's the emergency threshold that needs to be exceeded in order for you folks to mobilize?
Okay, I think we're probably already there, right? Even yesterday when I did a meeting with the House leadership, they brought up the same concern. So I need to reach out with the director of DILR and see, there may be something in place, and I might throw resources at a problem that may already be in the works of being solved. Because I know we are trying to work with DHERD and getting that pool of state employees I talked about to support DLIR. So I'll get back to you, Senator.
So why do you think DHERD does not share the same sense of urgency? I mean, they didn't even send out the memo asking for essential, non-essential till after the committee hearing a couple weeks ago.
They send the list out to yesterday.
I cannot speak to that.
Maybe the
Yeah.
question then should be, General, is, having a plan, an incident commander and your majors, etc., everybody having to know what their responsibilities are and know when you're going to take action at what point. Is that happening at the governor's level with the departments? Because some of the departments, for instance, the lack of personnel in the labor department, the unemployment office specifically, it seemed like they weren't prepared, but didn't know that they could ask for bodies. So, to me, that's something like this and your plan maybe has to be shown to the governor and his cabinet.
Correct. So the governor has seen this, and the governor is the one that approved this. I mentioned at a previous meeting that, what we did here is we should have been planning this months ago, and we actually started 2.5 months ago by order of the governor, right? He wrote a letter. We started it, but we didn't have the right people, the expertise to finalize the plan, so there's a gap. And then when they briefed me, and I was like, oh, okay, this doesn't work, and that's when I asked to bring in some of the National Guard folks to help get this plan moving along. The challenge was we were building the airplane when the airplane was already flying, right? And it took us longer than it should have. So once we completed the plan, we got the approval from the governor last week, and then I made a commitment to Senator De La Cruz that I would brief the Senate leadership and then the House leadership, and then I gotta share this with the cabinet as well. But going back to the DHERD question, I mean, it was weeks and weeks and weeks ago that they put in the call, and they had I think 3 different categories and types of employees. They had the information. They were working towards identifying who would be available to be, redeployed and deployed somewhere else.
Okay.
But the implementation is that.
Yeah, I mean,
Maybe that was their intention, but I'm not sure the follow-up, because the memo went out shortly after. Okay, Senate President has a question.
Senate President will be right here.
In the meantime, is somebody else?
Okay, does anyone else have a question in the meantime?
I guess, just in terms of following up, that you are going to be meeting with the cabinet, so they have roles to play and is that identified so that they can actually.
right. So
move more
again,
urgency?
we'll brief them, and then they'll inform us too, right? This is where we can plug in. But they were part of developing the plan. So we had different departments, especially primarily from health, right? And then we even had the county supporting us with this.
They put
Yeah, we
people-
didn't do this in a
They
vacuum.
had people there too to follow
Oh,
up, not just.
we met with DHERD 3 to 4 times just to kind of get the.
Sorry, I was talking to Captain. Oh, my time. The mic's on. Hello?
Yeah,
Can hear you.
You're on.
Okay, so for that point that Jared was making, General Hara, the other day when I talked to Mayor Kawakawi, I think it was Monday, part of his concern is he has, even stricter requirements for Kauai, but part of what he was counting on is people getting those checks. So they were staying at home, they were, flattening the curve, and they would have money to be able to get whatever food and necessities they needed. And because of the length of time it's taking and the inability to even get in, the frustration is mounting, and why are we doing this, and I cannot even now afford to buy stuff. So I just wanted to share the concern expressed to me by Mayor Kawakawi, 1, and 2, the fact that as people are getting more and more frustrated, just like the tenor of the emails we get in on this proposed salary cuts, it's not pretty out there. And then the second thing, to the point about Donovan asking on the urgency of DHERD and everything else, when I talked to Mayor Kawakami today, he was able to tell me that he has 1,200 employees. Before they went out, he impressed upon the County of Kauai employees that while it is at some risk to you personally, it's vital that you show up to work to provide the services that the community needs. Of the 1,200 employees, 777 are reporting to work. Then he could give me a specific number of employees who are working remotely from home and were producing between 75% to 100% of efficiency when they were at their desk. He was then able to give me a specific number about how many people were producing between 50% and 75% of their efficiency when they were actually physically at work. And then he identified who were clerks at counters and other people who would interact with the public that could not work remotely, that are now undergoing training so that they are going to be able to perform remote functions using technology. And I'm just sitting there stunned, and I realize that the County of Kauai is a lot smaller than the state of Hawaii, but what it really requires is a sheet like you've got up on the board to say, this is the task, this is what you're checking in, this is what your job is supposed to be, this is what you're producing in for the work, and that each of the departments don't have this kind of thing, and that the Kauai County mayor can rattle off these statistics to me. I was just totally flabbergasted by what I've been seeing in the COVID-19 hearings and then hearing what is happening on my home island.
Yeah, thank you, Senator. And during today's video teleconference, Mayor Kawakami did share that. He broke down those 4 categories for all of the counties and the governor. So we are familiar with what you just did.
Yeah. So I guess on Friday we're supposed to have DHERD to report back, and that's the committee is really concerned about the pace of movement over there and the lack of leadership and direction. So we're hoping that we can get that settled, because that's an untapped pool of resources to get things moving.
And I was just on a phone call with Riker last night. We were talking about that kind of stuff. So.
But I think part of it is because the leadership upstairs, we know that the chief of staff has given orders that say, don't provide us with information. And why, I don't know, but it is not helping our state. It's not helping the people of Hawaii, and it's surely not helping us get unemployment checks out in the hands of the people that need them urgently. So I don't know.
Yeah, for right now, I don't know of any constraints, and I think no one's holding any information from you now. This committee made it clear, right, that we need to.
But some of the stuff we asked for 3 weeks ago, and only now it's trickling in.
Okay.
So the legislature still identified 40 people to go and help with UI at Department of Labor. Yeah, they still haven't taken that.
We tell them every day, every time we go.
So if he's 57 people short, I know they were able to provide him 18 people. I think a majority of them came from the Attorney General's office, even though they have one of the smaller departments. The other departments have a lot more people that could probably get transferred over.
So today I'll try to reach out with Scott, and then tomorrow we do have a cabinet meeting, so all of the directors and deputies will be on.
Yeah, at the very least, they could distribute, even if you identify the people, they could already give them the training manual so they can prepare.
And my thing is that right now in my head, what you're saying about getting the ways to open up the airports and getting our economy back up and running. A lot of people is asking, right now we don't even have the airport and this disease or this infection or whatever you like call it, this crisis in control. I understand the other governors in the other state wants to do what they need to do, but they don't have a big fluctuation in tourism. We do. So until we can control the airport and the tourism coming into our state, and I understand there's revenue and get money from the FAA, but the bottom line is who is I know this is Dr. Culiano, but I want you to pass this along to the governor, because if we're thinking about opening up and lessening the stress on the community and opening up certain things, what are you going to open up? You can't open up a restaurant, because then you're going to have people sitting down with no masks. You open up the airport, we'll get more tourists and non-essential traveling, and we'll get more people sick. I mean, I don't think we're even at a point to even be entertaining putting on the slack on the economy, because I understand, there's a lot of things that are happening, like, we're not getting revenue or whatever, but making a revenue and people dying. I mean, I don't know how you can balance that, because right now we don't even have a hold on the airport, and the community and our citizens in Hawaii don't even have a trust in us that we can even secure the airport. And then we're going to open them up for tourism and say, okay, we got this in place, safety mechanism, but then we're worrying about the planes coming in, but we're not worrying about protecting the people. And right now, we can't even protect them now, because 300 plus people is coming. 300 plus people is not really being monitored. 3 phone calls, they're not there. What you gonna do? Slap their fingers? Slap their hand? Some of them staying here less than 14 days. I mean, it's still, and I hear they're giving, this is the part that the governor, maybe someone out there in the state should be calling the airlines. Why and how dare you guys giving them $70 trips? That's a total disrespect to everybody in this room in the state of Hawaii. They're giving them $78 trips to come to Hawaii. That's a slap in the face for every single one of us here. That's totally disrespectful. I mean, who wouldn't take a chance to coming over here knowing that when they come to the gate, they're going to high-five the guy and they're going to keep walking? 3 days here is nothing. They can take the chance, but the chance of them coming on the 4th day going home and being infected is what's threatening and making a lot of people scared in the community. But until we can have a hold of that, I don't even know how we're even entertaining, and I'm not saying it's you or the governor, but I don't even know how we're entertaining that we're going to put a relax on the proclamation that the governor gave. I don't know how we can go forward in doing that.
Let me go back to what I talked about, right? Remember I said that the center of gravity, the most important thing is for us to be responsive, and we need to anticipate needs, right? So one of the things I'm anticipating, at some point, we got to open the state up, right? And to be able to do that, I got to have a plan. It doesn't mean I'm going to do it tomorrow. Maybe it's a month, maybe it's 2 months. There's certain indicators that will tell me I can start relaxing certain policies, or the governor can start relaxing certain policies. But I got to have that plan and framework in place. And I got to start now. I don't want to be building that airplane when we're there. I'll be in the same problem. I'll be too reactive, right, as opposed to responsive. So I'll just throw a few things out. So as an example, the travel strategy, as advancements are made in testing, maybe like we get the 5-minute test or something. I talked about partnering with the other states. Maybe every single passenger could be tested and proven negative for COVID-19 and or tested with the antibodies that said they already had it, so they're not a risk. And we can let them come into the state. And again, this is future, right? But I'm looking at how can I open up the airport. There's certain criteria. The other one is we need to be able to improve our testing capability, the monitoring, and then the contact tracing. That's why I said that's another capability capacity that the National Guard can do. So as we open it up, let's say we have indications that it might be a cluster. Then we can surge testing in that area and then throwing in certain response and resources so I can shut it down immediately and prevent the spread. And we identify those clusters. The other thing is making sure we're protecting the vulnerable population, right? A lot of these younger kids, and that's just a scary part, right? They catch it, and some of them don't even have any symptoms. But they're the ones, if I go visit my grandma, I might infect my grandma, and worst case, having grandma or grandpa die, and that's what we're trying to prevent. So the new norm is really trying to isolate the most vulnerable population, so the elderly and those with underlying health conditions. as we get through that herd immunity, right? As more people get the infection and build the antibodies, that we don't need to worry anymore. And then what I'm pleading, I'm begging everyone, you out there, the community, is follow the social distancing. Stay this far away. I going out running and I still see people out there congregating in the small parks right next to each other. I was on a video teleconference and I see people hugging each other. We got to stop that for now. We got to keep that distance so we don't spread. And that'll help to maintain that curve. So if we change that norm, getting to the new norm until we can back to the regular norm, we got to change our lifestyle and the culture and how we do it. And going to, like you said, like the restaurants, right? There could be a way that we can do this safely. So all of the food handlers, from those at the delivery to receiving, stocking, preparing, handling, to the people that serve the food, all the way to the payment. If those people have the proper protective measures on, maybe plastic shield by the cash register, the tables are far apart, so even if they don't have masks when they're eating, 6 feet apart, maybe you limit how many people are in the restaurant. We got to get that kind of plans now. Not when, oh my God, I got to open it up, we're going to die on the vine. And that's the whole point, what I'm getting at. I'm not saying we're going to lax it tomorrow or next week or next month, but I got to start the planning now. And that's all of that, what I'm talking about, nests in with Alan Oshima and his COVID-19 recovery. Recovery, right? Because a lot of the stuff that we need, as we get the money, we need to put the money in the right place. Both the response and recovery got to be nested together.
So the money that you're talking about that will help pay for that is the money that you guys will get for the virus stimulus package.
So I'm not exactly sure how much I'm getting yet, so I had put in a budget. So I'm looking at some things that we will need for me as the incident commander and all of the emergency management team, that whole enterprise. I need to still do response. But then the whole bulk of the initial first tranche of the 1.25 billion will go to Alan Oshima, and there is getting stimulus and grants and everything else, and getting the recovery going. So I would, to be honest, I don't have the bandwidth to do both, right? And that's why I kept pleading and begging that we create this team that can focus on recovery. And then now we just got to merge the two together, and we are working very closely.
Thank you.
Mm-hmm.
Okay, so if that's the concern, enforcement to ensure that happens and people take it more seriously is at what level, and how do we?
So primarily the counties, right? Because they have the law enforcement arm, and then now we're utilizing, when we stood up more of the National Guard, they're augmenting law enforcement to help them. Some of it is checkpoints. We're going to do contact tracing, and there's some other things that the county will request the support of the National Guard. You're talking like overall enforcement, right?
Yeah, so for instance, if you said you went jogging, you see them. Who do people call? They just call 211 or 911?
If it's blatant, it's 211 or 911. Yeah.
Because I think that has to kind of be part of the message. Is that if you see people
so
in clusters, call 211.
One of my high school classmates, I say, hey, I'm party across my street. He sends me the picture. Call 911. And they called 911. And then the cops go over there, maybe give them a warning, shut down, go home. Or, screw this, you guys so blatant. Here's the violation. But we are stepping up. There's some. I'm trying to get some what we call vignettes, right? The small stories on some of the success stories on enforcement. I'm gonna get a little bit ahead. So Kauai, they had a military guy go there, and then when he left the airport, I think he made a left turn instead of right turn, and they were like, "Hey, this guy's not going to his hotel, right?" So they stopped him, gave him a warning, and then off he went. And then later on, they caught him at a, I think it was a supermarket. Click, click. So that guy and his girlfriend got arrested. And then now they said, hey, it's military, right? So we passed that over to Indo-PACOM. They do research. The guy is not assigned to Hawaii, but that information went up through that individual's chain of command. And now that person is also facing additional charges on the military side. So the enforcement is starting to step up and it's starting to be very effective now.
But going back to the communications plan, can the communications team start using social media or advertising to say, be aware, you are going to get a ticket? I mean, really, just get it out there.
Yeah,
Promote
absolutely.
the fact that, I'm not sure where, it's Cindy.
Sounds like something we asked DBED to do about 3 weeks ago and hasn't been yet.
Do you know what I'm saying? Instead of maybe us waiting for the media opportunities through regular media, actually get the communications team to start blasting that out.
Okay.
Yeah, so like what he's saying with the communications, like we've been having a lot of emails and even text messaging that the gambling establishments are still open, social hours, 24 hours a day. And I've been forwarding them to HPD and having HPD look into it, but is there gonna be another way of getting more enforcement to these establishments? I mean, we already know it's illegal, but they're doing it right in the community. You get the address, and they're all hanging out and just going about their business like it was not Las Vegas, because Las Vegas is closed, but they're still having gambling houses in my district that is still operating, and we're getting numerous of calls. All I'm doing is relating, calling 911 and relating that. But how more of that going to continue into it escalates to community members taking action?
But I just want to say that the gambling house is illegal even without COVID.
Yeah.
Well, that's what I said, yeah. But I mean, there's still...
Well, again, it's the police, right? The police is responsible, so calling that 911 is the right answer.
Okay, I want to go back to this chart.
Sure.
Going back to the communications team, how do they start to, and I guess maybe we're getting ahead of it, or I might be getting ahead of it, where you still have to sit down with them so they can start to implement some of these measures.
So some of them are implemented and
some are not.
And some are not, correct.
So let's just look at public response, really.
Which color are you in?
And let's just say yellow.
Okay.
Some of it apparently has changed. We may be in, okay, first of all, let me just ask, from your estimation, where are we in this chart?
I think we're at early level 3. And that's why you look at a lot of the measures that we took place, we've actioned already. Restrict large gatherings, restaurant takeout only, closure of schools, childcare facilities.
Okay, so the communications team, I guess, would take a look at level 3 and start sending out messages to make sure that the public response is there.
Right.
In
that bottom.
Yeah, like a short video, whatever. What does that actually look like to maintain personal hygiene in today's time and space with COVID-19?
Yeah.
What does it, health advisories, I still don't know what that looks like because our text messaging idea got vetoed. So how does the communications team start to engage the public in getting that messaging?
Yeah, so Cindy McMillan has a pretty good strategy now that she briefed me up on. And you know what's pretty amazing too is like we wanted to ramp up public announcements, right? PSAs. And some of the local media are doing it on their own.
Yes.
So we were like, hey, we gotta leverage, the talent and kind of musicians.
We should be proud about. They're filling a vacuum.
Yeah, but
the government is not doing it.
Yeah, that's awesome. It's all of, I said all the community.
It's supposed to be supplemental.
We just little slow. Yeah. No, we're still gonna do it, but I'm saying it's awesome, right? The first briefing I had, the first press conference, I asked the media to be part of the solution in health, and they are. They've been awesome.
The government that's not doing it.
But you know what's really sad to me is that, we've been trying to help local businesses by doing the takeout dinners and, all that's on the food to go and all that stuff. And then the governor goes and makes an announcement that he's going to cut everybody's salary in the state by 20% and start furloughing people. That has not even been discussed in the legislature. So now everybody who was planning to go buy food to go tonight, the restaurants are going to see a further decline in their business. So part of the strategy is they have to be doing it in the right way. I think the governor was just so premature. I mean, yes, it could happen, but we've not even talked about it. And we know that there are many things in our budget that can be cut. And we haven't had the chance to sit down and look at that budget. But for the governor to do that, I think is just putting a scare tactic, particularly in teachers. All of us are being inundated with emails. And I think we should, forward all these emails to the governor. Let him respond to them too.
Well, it's mental stress on them.
Yeah.
Everybody's going through stress already, and these families already worried. And now this comes up as they're saying, oh, it's a last resort. Well, that's not the headline. The headline says 20% for 2 years. I mean, it's just...
But the part of it is when we talk about recovery, recovery will be much easier if you're here trying to get up than if you're here. And we're going to hit that here if we keep sending false messages to the public.
So was this a press release or
Yes.
was it actual press release? That 20% for 2 years? I think it was
Was it on newspaper?
No, it was a statement from the teachers union. It was a letter from the teachers union.
Apparently,
No,
he met
it's
with
before that.
He met with the teachers.
He met with the unions or something.
Was it on newspaper this morning?
So that's the kind of stuff, we were not even in the loop.
Yeah,
Right.
that's true.
So this is how to make sure we can stabilize, right? Are you in the process of planning how we start to go back to level 1?
Yes. So like some of the things I rattled off right off my sheet, and then what we're partnering with Alan, and then Friday we have a big meeting with the governor and the recovery team and myself, and then we're going to actually socialize that in the afternoon with the counties, and the mayors will be on.
And I know this is theoretical, not necessarily, there's lots of second guessing out there. But just from your opinion right now, when do you think we would end up going to level 4 from a timing perspective? And from
So my point is never getting to level 4, right? From day one, like I said, if we do the social distancing, I don't have to ramp up any policy restrictions, and then we have to get, the stay at home and everything else. Truly, if we do the social distancing and everyone, don't do the parties, like I said, that'll prevent us from getting to the next level. I don't want to get into that more strict
and I think we all
measures.
agree. So I guess a lot of things are contingent upon the social distancing and the contact testing and contact tracing. So what would your potential timeline be to move back to level 2? Provided that people follow all the things you said, it would be a month?
A month, 2 weeks to a month. And that's, we're still watching. We haven't made a determination on the April 30.
Yeah.
I'm hoping in this next 15 days, if everyone listens, we can say, we can start relaxing some of the things, not everything, throttle back a little bit, some of the stuff I talked about, and we slowly get the economy going. We test and watch and monitor, and if it doesn't spike radically, maybe we throttle back a little bit more, and then slowly we start moving back into the next color.
Okay, so you're looking at the numbers of cases to determine when we go back to level 2 and then
Yes,
when we
that's the number one indicator.
Okay.
Do you think we'll have some kind of chart like this that will help us plan our recovery?
I need to check, but I think it would be helpful.
Yeah,
Yes.
because I think like one of the things, I know that the superintendent made an announcement today that there will be absolutely no graduation ceremonies. And I don't know if, it's too premature to have released that information or not, but, I'm not, saying that it was a bad idea or whatever to announce it. I'm just saying, was the timing right? But, we're planning for recovery also. I think there are timelines that we need to look at also.
Well, that's where I think the departments have to go through what you guys created and determine, does a graduation, for instance, is that allowed only at level 1? And if, if we're not at level 2, then no, we're not doing those type of events.
Yeah, that's a good point.
So if as departments and organizations, like, I know at the beginning when we first met, they talked about Mary Monarch. And should we cancel Mary Monarch and all of that. I mean, if we were at that point already at level 1 or level 2 and they meant to cancel, And that's the kind of guidance I think a lot of
Okay, yeah, that's a good,
people
thank
needed
you.
back then.
Good.
In that regard, who's collecting all the data? So there's surveillance testing, there's all kinds of contact tracing and testing. Is it coming to one place so that you can do a progression? Okay, the cases are going up.
Yeah, so Department of Health, right, Department
So
of,
you connected that to
outbreak
your
and-
inventory too. So that data is kind of like what you track, right?
yeah, Dr. Park and her crew. Yes.
And so it also tracks with the inventory. How many beds do we have? How many?
Yeah, we tracked it
all of that
continuously.
connected to need.
Yeah.
Okay, so if there's no further questions, I know this team has a lot of work to do. So we appreciate your
Yeah,
hard
thank you.
work and
Very good work.
really on behalf of the public, thank you for all you guys are doing and the sacrifices that you're making. So thank
I
you.
appreciate it. Thank
So
you.
if you wanted to see it, it was on channel 2 news in the morning about the 20% cut.
Yeah.
And I just wanted to say too, so out there in Olelo land, everybody listening, again, the legislature has not had a chance or an opportunity to look at whether or not we need to do a 20% cut.
I think nor did the governor. I think it's all in the discussion, but I don't think a decision has been made.
He should have said that it was, private information. But, the unions need to let their people know.
Right.
And God knows we can't afford to lose any teachers because we're going to give them a 20%.
Well, I think it goes back to your point from the beginning. If things hit a certain level, you gotta let people know things are coming.
Right.
But it wasn't done in that fashion.
Right, like if we're at
So, Senator-
4, then maybe at that point we have to consider pay cuts, consider this, consider
Yeah,
that.
yeah,
And
yeah.
now that we're in beginning
Between
of level
2 and 3,
3.
yeah.
Yeah.
But it's not just the teachers, it's Unit 3 and Unit 9. I mean, people just calling. I mean, they were thinking it's the whole state, 20% across the state. I mean, that's the misconception that is going on. And they're asking us where we stand, and we was caught off guard.
We don't want teachers.
So the governor, in his press conference, the governor just now walked back the 20% cut statement, but pledged to take a pay cut along with his cabinet. So I don't know if you know, General, but I think you get a pay cut.
Just gave us
Wow, bro!
The governor just announced it.
I'm a team player. All in. Whatever is needed for the state, absolutely. Everybody's suffering. We should be suffering too.
No, thank you.
Thank you.
Thank you.
Thank you, General. Thank you, all of you.
Thank you, everybody.
Thank you, all of you.